Hi, everyone. I'm Gabby Reith Miller from the Riley social media team. And today we're going to be talking about the viral activity that's going on in our community. And we're lucky to have one of our infectious disease doctors join us this morning. Dr. Wood, thanks so much for being here.
Of course, happy to be here.
So, first, why don't you tell people just a little summary of what you do at Riley and what your involvement is with kind of overseeing monitoring this kind of illness in our patients?
Sure, yeah. So I am a pediatric infectious disease specialist here at Riley. So that's kind of a mouthful. What that really means is that I take care of kids both in the hospital and outpatient who have infections of kind of a variety of different things, anywhere from kind of common things that kids need to be in the hospital for to kids with more kind of chronic or specialized conditions that get more severe infections. So we kind of see the whole gamut of different children and take care of them here at Riley.
Okay, so in this particular conversation, we're going to be focusing in on the viral activity, right? We're talking flu, RSV, COVID, and all of the other viruses that you guys kind of monitor. So I have two little kids, and I know my friends, relatives, everyone has been dealing with back-to-back illnesses. So what are you guys kind of seeing in the numbers that you're, in the hospital with the kids?
Yeah. So I think what you're seeing and feeling is kind of reflected in the numbers that we've seen in the hospital, and it's pretty common right now. So yeah, we are definitely seeing viral activity. Kind of the big ones you mentioned, RSV, flu, um, and COVID-19 virus, SARS-CoV-2. All three of them are pretty active right now. And they've been pretty active since, late fall, early winter, kind of November, December time, and certainly January was no different.
And so I've had the chance to see a chart that you guys have or a graph that kind of shows the peaks over the years when things kind of level out a little bit. So a top question for parents, I think, is when does this kind of viral activity tend to slow down? And are we nearing that point where things kind of ease up a little bit?
Yeah, I think that probably the word right now is maybe cautious optimism. We're certainly seeing RSV come down a bit right now. Flu is still pretty prevalent, but RSV seems to maybe be coming down now. Each season is a little bit different, but overall, it does seem like some of the viral activity might start to be trickling down. And then we've had some pretty interesting and unusual seasons the last several. This season, at least early on and kind of midway through, maybe seems to be more typical of the viral seasons we saw back in 2019, 2018, 2017, where viruses started to come up really in, again, end of fall, November, December, kind of peak in January, and then start to trickle off February and March. And it seems anyway so far that that's kind of the case right now. So again, RSV, hopefully, maybe we are seeing a downturn. Hopefully that will continue to be so. Same thing with COVID. There are certainly cases, but that seems to be coming down as well. Flu is still kind of is still there and definitely still out in the community. So we haven't seen a big downturn in flu activity yet.
And so, of course, depending on a child's risk level, you might change your activities or take extra precautions. What are some of those types of patients that you see end up perhaps in the hospital with the flu, with that RSV? Maybe parents need to hear about that maybe age ranges or other conditions that a child might have that may make them more likely or at risk of ending up with, a very bad strain or reaction to these viruses.
Yeah. So typically, with all these viruses, the younger children tend to be hit harder. So usually kids under 1 year of age, especially kids less than 6 months of age, tend to be, when they get these things, especially RSV, but flu as well, they tend to be pretty hard on those kids, ending up with mostly pulmonary issues. So respiratory tract infections, that's kind of the big one. But certainly kids of all ages can become infected and become more severe. But it is usually those our younger kids that we tend to see, especially with the RSV and the bronchiolitis, as well as kids with underlying conditions of their lungs, underlying conditions of their heart, or sometimes neurologic conditions. So those kids that tend to have more chronic type illnesses or more issues with their lungs, including babies that are born prematurely. We know those babies, again, lung development can be an issue for them. And so they tend to be hit a little bit harder, especially with viruses like RSV. one thing we do know is that those children, but any child, that really decrease the risk, especially for flu, if they're vaccinated. So we know that kids that get vaccinated, the vaccine is really good at keeping kids out of the hospital and keeping kids from getting severe illness. It's pretty good, not perfect at keeping you from getting it at all, but it is very good at keeping you from getting severely ill or going to the hospital. So that is kind of the main big thing that we have to keep kids safe is the vaccine, I guess, in people in general.
And I did want to ask you a little bit about this because Dr. Christensen, one of our other infectious disease doctors, mentioned the RSV vaccine for pregnant women, pregnant patients. Can you just touch on that a little bit in case someone's watching and saying, "Oh my goodness, I'm about to have a baby soon. What can I do to keep them safe?"
Yeah. So very, exciting early kind of end of last year, mid summer of last year, we found out that there was an RSV virus, RSV vaccine approved for pregnant women. Yes. And so the idea is women in kind of that third trimester between 32 and 36 weeks can get this RSV vaccine as a way to protect their baby. So the idea is moms can get vaccinated, that they build those good antibodies to fight the virus. And then those antibodies are passed on to baby before they're born. So that baby is protected in those critical, first 6 to 8 months where we were talking about where those babies are most at risk for infection. And we have seen that, the vaccine, again, from mom giving those antibodies to baby has been very good at protecting those young babies.
That's so amazing to hear because as someone that had babies in the middle of RSV season, it was nerve-wracking, right? Trying to keep them healthy. So great to hear an update on that. And then my last question to you is if parents are watching, what's something that you'd want them to know to try to help to keep their kids as healthy as possible, in this time of the year? Anything they should really keep top of mind as they're out and about and trying to do things with their families?
Yeah, I think that the big ones, and again, as a parent as well, my kids are a little bit older now. They're 9 and 7, so we've gotten out of the super small toddler age, but like it's the same old stuff, right? It's hand washing. And so, keeping a hand sanitizer in your car, in your purse, in your, backpack, whatever you're bringing. And just when you're out in public using that, our kids are all over the place. They're touching everything. I'm happy, right? Like I want them to get back into their normal stuff, but keeping their hands clean because everybody puts their hands in their mouth and touching everything. So hand washing, hand clean is super important. The other thing, right, other than vaccines, so I talked about that. So getting your flu shot each year, getting, for moms, getting RSV vaccine. Older adults can also get, so adults over 60 years of age are also eligible to get the RSV vaccine. That can protect both them as well as people around them. But then kind of, if your child is sick, don't go out in public. That's the kind of the big one too. It's like we're all, anxious and happy to be back to somewhat of our routines. But staying home if you're sick is really important. It protects everybody around you. And it's a good way to stop the spread in the community. So doing that as well. And then if you do have those high risk conditions, right? If there's a problem with the immune system or some of those chronic illnesses, if you're going out in public, a mask is always a good idea. We know that they worked really effectively during the pandemic. And so keeping, especially for high risk folks, I think it's it's not a bad idea to wear a mask, or anybody that, would prefer to wear one. We do know that they're pretty good at keeping the viruses away.
Well, this is also good to know as we kind of keep trucking along this winter and getting through these illnesses with kids. So appreciate your time and just want to say thank you.
Sure, of course. Thank you.